A good knife is sharp, is safe, is fast, and is accurate. Hi, my name is Peter Dowd, founder and principal consultant at Inago, the world leader in sharpness measurement. I'm based in New Zealand with my wife and 2 sons and have extensive experience in injury prevention, processing efficiency, and product development. I have had the privilege of leading the New Zealand Health and Safety Forums for both the meat and seafood industries. I have led a wide range of industry projects ranging from knife sterilization to pituitary gland extraction, injury data analysis, to new beef jerky products, and of course, knife sharpness. With world-first innovations in a variety of areas and over 2 decades of applied research into knife sharpness, Inago has become a global name, with customers in almost every continent. With musculoskeletal injuries, there are 3 key risk factors: effort, opportunity for recovery, and health. Effort relates to the forces that we need to apply and the moment generated by the distance of the force from our joints. For example, a 20-pound carton is easier to carry close to our body than at arm's length. Opportunity for recovery is impacted by how long we need to apply the force and how frequently. If we only carry the 20-pound carton once an hour, we should have ample time for our muscles to recover. But if we are pushing a dull knife thousands of times a day, it is likely that our tissue will not be able to recover between exertions and gradual damage will occur. When we do get an opportunity to recover, our rate of recovery is influenced by the ability of our body to be able to refresh the tissue by transferring harmful waste products away from our muscles and to transfer nutrients and oxygen in. When our vascular system is inefficient, for example in someone who has cardiovascular disease or who has constricted blood vessels due to smoking, the system is less effective and gradual damage is more likely. What we can see here is a graph showing time in seconds on the horizontal axis and force on the vertical axis. This graph was generated using an instrumented handle that measured the actual forces being applied by someone performing meat cutting tasks. Both lines represent the same task being performed by the same person. The blue line was when they were given a dull knife, and the orange line a sharp knife. The difference in force is extraordinary. But not only that, the task was also slower with a dull knife, and so the person is in the unfortunate position of not only having to apply more force for longer, but having less time in between tasks for their muscles to recover. We see that substandard sharpness causes increased grip forces and moments, insufficient opportunity for recovery, and reduced vascular efficiency. Clench your fist with me for a few seconds. 1, 2, 3, and 4. And then open it up. And look at your palm and fingers. See the white areas? This is where blood isn't flowing and creates opportunity for damage if we need to maintain high grip forces for long periods of time. However, sharp knives enable faster processing, increased quality due to improved accuracy of cuts, possible because the person doesn't have to push so hard, and increased yield. Not only do we get higher absolute yield, meat off the bone, but we also get an increase in what I call effective yield, which is the proportion of meat that stays on valuable cuts rather than being lost to trim. When someone's knife slips while boning, the slice into the product must be trimmed to maintain the appearance of the product, and this trimmed meat goes from perhaps $20 per pound to potentially less than $1. These graphs show the results from a study at a global processor looking into the impact of sharpness testing, with the top graph illustrating the results of a comfort survey showing that at the beginning of the study, most people were hurting a lot most of the time. By the end of the 3-month study, knives were considerably sharper, with the astonishing result that not only did discomfort almost disappear and injuries drop to 0, but the team members were so much more efficient that they were able to process high-value product that required 30% more cuts per minute, while maintaining an injury rate of 0. We also discovered during our preliminary survey that even when these people are suffering a lot of pain, they don't tend to tell anyone. One day, they just don't turn up. Knife sharpness is a critical component in a safe and efficient processing operation, and awareness of the need to control it is growing globally. Feel free to contact me at the address shown with any questions, and remember, you can't control what you can't measure.